Hello, folks. Welcome, welcome. Glad you're able to join us today. As you're getting into the Zoom meeting here, I'd like for you to put your name, the location in where you're joining us from, and also put your favorite fall food since fall is upon us. Go ahead and put that in the chat. And while you're doing that, obviously we're going to do a deep dive on the federal shutdown, on the government shutdown. We have some special guests that I'm really thrilled that are able to join us today. I'm also going to put in our online tool. This tool will allow you to send a letter to your member of Congress and also to both senators regarding the federal shutdown and the demand of rolling back the Medicaid cuts and the extension to the extended ACA tax credits, and then also to extend the ACA tax credits, and then also to stop Trump with his just unilateral freezing of spending. So if you could click on that, save that, share it around. Let's see if we could put in where we're people all over the state I can see already. Squash, homemade chicken soup, apple cider. That's a favorite one at the fairs. Butternut squash soup. Cameron, my grandmother used to make a pumpkin pie, and after she died, I got her recipe. I found out it had no pumpkin in it. It was actually a butternut squash pie. Who knew? I didn't know, but it was good. I make it all the time. It's fun. Cider donuts. All right. Folks are still coming in. They're still joining us. Welcome. If you're just joining us, please put your name, location that you're calling from, and your favorite fall food into the chat. Yeah, I think that's right, Jillian. It kind of feels like pumpkin anyway. All right. Favorite food. Let's get some people into the chat. Favorite fall food. All right. I'm really excited about today's call. We'll be hearing from quite a number of folks and also get kind of the inside game of what's going on right now, what's happening in DC regarding the federal shutdown. So welcome, everyone. Since we have a lot to go through, there'll still be people coming in. I think we're going to go ahead and kick this off. So once again, I did drop the tool in the chat so you can send a letter to your members of Congress about the federal shutdown. We've already, just kicking this off, we already have over 1,400 people who have signed that tool, which is a great start for us. We'll be sharing it on, or we've already shared it on all of our social media, and we'll be popping that up as this goes on. So I would like to start off by actually turning over to the executive director of the Pennsylvania Policy Center, Mark Steer. Mark?
Thanks, Dwayne. Thank you all for being here. I'm going to be very brief. You're going to hear a lot of details about the politics and the policy. I want to leave you with three critical messages. Number one, the budget shutdown is about Democrats using the only leverage they have in D.C. to ensure that health care is available to as many people in Pennsylvania and across the country as possible. The goal is to extend the expanded tax credits for those who get insurance on the healthcare exchanges, the one which we call Penny in Pennsylvania, and to reduce cuts to Medicaid that were in the one ugly, huge bill. That's the first thing. And the second thing it's about is to ensure that the budget Congress passes is, as our Constitution requires, the budget the federal government follows. There's no point in passing a budget if Donald Trump can take the budget as a suggestion, not a requirement. He is obligated under the Constitution to follow that budget. Democrats are trying to make sure that he does that, as well as to ensure that people get health care. We're going to hear later how bad the situation will be in our state and across the country with regard to health care, and the goal is to make sure that this terrible stuff does not come to pass. Number two, Democratic senators all across the country have been standing up for us, and we need to support them. The one exception is our Senator John Fetterman. Both our senators, Fetterman and McCormick, need to hear from us. Dwayne gave you our online tool. I just looked. We've got almost 2,000 letters sent already, and we just launched it recently. You need to sign it, but you also need to share it with 5 friends and tell them to sign it. We need to get Fetterman and McCormick to hear what we're saying. And the third point I wanted to say is Republicans are telling one of the most brazen lies they have ever told in response to the Democratic demand. And look, calling them one of the most brazen lies is a very, very high bar, because there have been more than a few coming out of the mouths of our president and Republican senators for a long time. They're saying the goal of Democrats is to provide federal funds for undocumented immigrants. This is simply and totally untrue. Undocumented immigrants do not get federal funds to pay for their health insurance. Frankly, that wouldn't be a bad idea, but that's not what we're talking about right now. And so if you hear that lie being told from anyone, friends, family, reporters, anyone, call it out and tell them this is about protecting health insurance for American citizens, people in Pennsylvania and across the state. That's all I'm going to say. I want to turn it over to John Foti from Americans for Tax Fairness, who will give us, as far as he knows, a little more detail about what's going on in the back rooms and closed doors, behind the closed doors in the federal government.
Thanks so much, Mark. Really appreciate all our Pennsylvania friends having me here today. And just thank you all so much for all the work you're doing over the last couple of days to really elevate all of the asks and what we are fighting for that Mark just went over. And Mark made a really important caveat there. This is, as we know it now, things are changing literally by the minute. We are on hour-by-hour calls with House and Senate Democratic leadership here in D.C., talking about the ways we keep up the drumbeat and keep the wind at their backs as they are fighting for their health care. So I want to start, just take us back to the beginning of this week. And the government shut down on midnight at Tuesday. And that was after 2 failed votes to reopen the government. One was on the Republican continuing resolution that would have continued to allow the administration to unilaterally cancel federal funding for projects all across the country, and it would have done nothing to prevent these premium spikes that all of us have been talking about. They also voted on the Democratic CR, which would have restored those healthcare cuts, would have ensured the ACA tax credits continue. It has incredibly strong language, basically saying a budget deal is a budget deal. The administration can't go back and say, now just us Republicans are going to cancel this funding agreement that we just made with Democrats. And that vote failed, and Democrats held the line up against that. And one thing I just want to make sure folks saw, which is Fair Share America and Americans for Tax Fairness, along with a whole bunch of our partners, held a massive rally outside the Capitol as this vote was happening. And if there was any questions about whether or not your voice is making a difference, Senator Schumer and Leader Schumer sent his team over to the rally so we could make the announcement that they had held the line in fighting for our health care. So electeds are hearing your voices right now, and they need to keep hearing it in this moment. At the same time, it seems that negotiations are frankly just not happening right now between either side. All of us know that the president met with congressional leaders at the White House on Monday. That meeting could not have gone more poorly for a couple of reasons. A, folks probably saw afterwards, but the president decided to post an incredibly racist meme attacking the House Democratic leader. I am not going to repeat or even call attention to what it did. It was just incredibly racist and not something a leader of Congress should be subjected to by the leader of the free world. Even more so, it seems that the president doesn't even understand the ACA tax credits and the issue that is facing a lot of Americans. And I don't say that to be dismissive or question the intelligence of anyone. I simply mean to say it seems the president's advisors have insulated him from the impact of his own policies on the public. And so part of the reason that this battle needs to happen now is because of the fact of we don't have until the end of the year to be able to renew these premium tax credits. Notices are going to be going out in the next week and a half about the premiums going up, and marketplaces open on November 1st. So frankly, this has to be dealt with now. Otherwise, most Americans are looking at their premiums going up, by 50%, if not more, if they are getting their coverage through the healthcare marketplace. One thing I also want to flag is we have also even begun on hearing from union friends that even though their members have very good quality healthcare, their premiums are also going up as a result of millions of people potentially losing their health insurance through. Oop, sorry, I seem to have gotten muted there. So all of that to say is, even if you are not getting your healthcare through the ACA marketplace, this is going to affect you regardless. And so right now, leaders in Washington are nowhere on negotiating over this factor. However, Democrats continue to insist that until Republicans have a conversation about the tax credit and solving that now, there is frankly nothing to discuss about the federal budget, especially knowing full well that the administration has now begun canceling projects and programs in states all across the country. One resource I want to make sure folks have available to them is a new tracker that us and some of our national organizations have helped put together called shutdownreport.com. Shutdownreport.com basically gives you all of the latest information on premium increases, as well as the projects that the administration is now threatening to cancel as a result of the shutdown they created. So on one hand, the administration is saying that, that they don't have to do these, cancel these projects. They don't have to do this. But on the other hand, they're also using the shutdown as a pretext to be able to do that. Even more so, there are Republicans in Congress right now who are saying that they do not want to extend the ACA tax credits, that they actually want to see those expire. If you have a Republican House member who is a member of the Freedom Caucus, like let's say Scott Perry, they right now are advocating for these tax credits to go away, which means double-digit premium increases on Americans in Pennsylvania and across the country as well. So all that is to say, though, Democrats are beginning to think about what solution they have to continue talking about with their Republican colleagues. In the House of Representatives, those conversations really aren't happening right now. And one thing folks should just remember is it is all eyes on the Senate right now until Senate Democrats are able to force Senate Republicans to come to the table and have a negotiation over dealing with these tax credits. If, just to say, if Senate Democrats cave, this will not be voted on in the House again. It doesn't matter actually what happens in the House again. It will simply be passed in the Senate and then go to the president to be able to sign. So we really need to keep the pressure up on the Senate right now. And as Dwayne and Mark said, Senator Fetterman is kind of talking out both ends of his ears right now. He's saying, "Oh, I want to keep the government open, but we also have to deal with this with the premium tax credits." But he's not using the leverage available to Democrats right now to be able to force that conversation. And even more so, it's important to remember the context of which this is all happening. They passed $4.5 trillion worth of tax cuts for billionaires earlier this year. They did so and said that they can do that and bust the budget, no problem at all. But now they are holding tax credits for working people hostage while trying to shut down the government in order to cut spending even further. So there are a lot of holes in the Republican argument, and I will just say those holes are beginning to be spread tremendously wide open. If you have watched press conferences from Speaker Johnson, Leader Thune, and even the president over the last couple of days, their talking points have changed from September 30th to October 1st to October 2nd, and now they're even different today. And so all that is to say is our message has remained consistent and it is working. Public polls that have come out in the last couple of days have shown that the public is overwhelmingly blaming Republicans for the shutdown by as much as 17 percentage points. And when we see that, though, we have to make sure we press that advantage, that they understand that Republicans control the House, the Senate, and the White House. It is on them to bring Congress together to come up with a plan that can actually pass and get Democratic votes. They have to put that compromise on the table so we can actually know what they might be willing to do. And even the president's own words from past situations, he has said that it is on the president if Congress cannot reach a deal. So we have the momentum on our side. And even more so, Republicans keep changing their talking points. They were talking about healthcare for undocumented immigrants. Now they're saying a whole bunch of other stuff. And as Mark noted, all of that is a blatant lie. It is just frankly not true. Undocumented immigrants are federally barred from being able to enroll in the ACA marketplaces. And whether or not in a perfect world in the future they should have access, it is completely ungermane to the debate we are having right now. And it also doesn't have anything to do with those 5 million Americans who the Congressional Budget Office says will lose health care if we do not extend these tax credits. So all that is to say, the House has not been in DC this week. House Republicans have been nowhere to be found. The Senate has been here voting, but the House has not. They are planning to come back next week. And so part of what we need to do is over this weekend into next week, we need to keep hammering them and say we need a permanent extension of these tax credits. We need clear guardrails against this administration from unilaterally canceling grants. And then we need to be setting our sights in the future on what we do to cancel and roll back those Medicaid cuts that were in the big ugly bill. All of this is critical in this moment right now, because we know that with these folks willing to lie about the legislative negotiations that are happening right now, they are probably going to have another lie come Monday morning, and they are going to try to repeat it and see if folks run with it. And we just have to remain consistent while continuing to elevate the stories of those who are being impacted. So all that is to say is, and here's one other thing I just want to make sure folks encourage their Democratic lawmakers are when you encourage them to stand strong. They do not have to negotiate in public with the press about what deal they may accept on the shutdown. They are not negotiating with the press. They are not negotiating with them. They are waiting for Republicans in Congress to come to a table and actually negotiate with them. So if you are talking with folks like Brendan Boyle, Madeline Dean, Chrissy Houlihan, whomever, just encourage them. You do not need to be talking to the press about what deal you might accept. Instead, what they should be doing is having a story for someone in their district who is about to see their premiums increase and have that story ready to go and say, this is the person who I'm fighting for. And so all of this inside the beltway nonsense over, CRs, this, that, and the other doesn't matter when people are about to lose their health care. And so we just need to keep this on message. And that's the number one thing I can't encourage folks enough about. Message discipline here is our absolute best friend. If you're out there publicly, keep the story on healthcare. You should absolutely be talking about rescissions and impoundments with congressional staff, but it also might be hard for a mom who's taking care of kids and an elderly one to subtly understand the concept of rescissions while they're about to lose their healthcare. So I would strongly encourage just keep it about the healthcare while continuing to elevate those others asked with congressional offices. And the other thing I would also just encourage folks, which is let us know what information you need. There was actually just new polling that came out this morning that I am just about to drop in the chat from Kaiser Family Foundation. Again, a very, very nonpartisan organization that found that the overwhelming majority of the public, 70% of independents, Republicans, and Democrats all believe that the ACA tax credit should be permanently extended. So it is not only about using this moment for leverage. It helps even more when the public and the truth is on our side, and that's ultimately what is the case here. The truth is on our side, the policy is on our side, the people are on our side, and it's up to Republicans to come meet them where they are, rather than having this inside the Beltway conversation about whether or not about anything other than healthcare. So appreciate everything you all are doing. Sean, I see your question in the chat. Is it accurate that older people not old enough for Medicare will have drastically higher premiums than younger folks? Sean, I can't say specifically, but I will say there will be pretty big reverberations throughout the healthcare system if these tax credits are not extended. And as we said earlier, it is likely that all folks see their healthcare premiums rise. Even if you have a low premium right now, that is likely to go up as a result of these tax credits expiring. And one other thing just to say, it's also why we need a permanent extension of these tax credits. Because if we only get a year or something like that, then most of these health insurance companies are going to go, you know what, we're just going to be back here in a year or two. It's going to be the same old congressional nonsense. You know what, we're just going to jack up the premiums anyway, and we'll pocket the tax credits and we'll give it to our executives in the form of tax cuts. So that's the reason why we need this to be permanent, because we need these healthcare companies to know know that this lifeline for working people that is keeping small businesses afloat, that is keeping working people afloat, is going to be there permanently and into the future.
Wow, Fodi, that was an incredible update that we just got. Thank you for all that information. You've always been an incredible resource, seeing what's going on behind scenes, messaging, and being very specific too. Thank you, John. And folks, my colleague Jeff put in the chat. Please put your questions into the chat. We're going to be going through those as we continue through the call. But for now, I'd like to turn it over to our colleague, Hannah Lloyd from Fair Share America, to give us the perspective of what this looks like nationally. We're the local affiliate for the Center on Budget and Policy Priorities here in Pennsylvania, the Pennsylvania Policy Center. But there are organizations like ours and many of the folks on these calls that are fighting for healthcare in this moment. And so I'd like to hear what that looks like nationally, and also anything else that Hannah can add to what this strategy might be and how we're actually moving through this moment. Hannah?
Awesome. Thank you, Dwayne. And it's really nice to be with you all. It's always really nice to be with you all. It's also always a little bit painful to follow Fodi because he has so much information and is so very helpful. And I'm so glad that he was able to be with us today too. So what it looks like nationally, it's starting to look like nationally is what you all have already been doing here. I don't want to steal Dwayne's thunder, but I do want to drop in the chat the event that's coming up. Actually, I'll drop it when we're done talking, or maybe Dwayne can. The big event with the speaker in Breshnahan that is coming up on Monday. As of now, our understanding is he is still coming to town, and there's going to be a beautiful contrast with him coming to town and there being a healthcare over like billionaires vigil that's happening at the same time, which to Fodi's point about being militant about staying on message around these healthcare cuts and what they mean for lack of a better phrase, real people, keeping the stories at the forefront. But what we're seeing nationally is more of the same, people in district holding up vigils. I'm also going to link to, I don't know how many folks here have partners that are outside of the state or friends and family, but we've been searching on Mobilize, and we hope to have like a public list available soon. But of all the events that are happening around the country with an emphasis on healthcare, there are a lot of things that are popping up now. Fodi, forgive me, I don't recall if you touched on this. We don't know how long this is going to last, but at the moment it looks like folks are pretty dug in. So we anticipate it going on a while, and we want to continue. And it's hard because everyone here, we've all been working all year already, and it is another fight, but we want to continue to keep the pressure on. So the organizing around the country, it's focused on healthcare, it's focused on lifting up stories, it's focused on the real consequences and trying to stay on message as best we can. As Fodi mentioned, we had a big rally on Tuesday in DC. There may be more DC events to come because of your proximity to, well, some of your proximity to the Capitol will continue to alert you if and when those happen. We may have some virtual town halls coming up, some tele-town halls. We'll keep y'all posted. We'll likely, full disclosure, probably be coming to you again for some additional storytellers to help us lift up the message. Pennsylvania is so important. And I also like Lynn and Jen on the call who have already told your stories in different capacities and have been super helpful. We're just really like more of the same, but laser focused on healthcare. And it's working. Like the polling today, I saw the speaker Johnson was on all the morning shows and was getting a lot of pushback from the anchors around like, well, actually, one, people are kind of blaming Republicans and Trump, and two, the healthcare stuff, their lies are not breaking through, but the healthcare increases are. So that's kind of what we're doing. We at Fair Share America, we've got some graphics coming. If there are things you need, any sort of additional support on talking points, op-eds, etc., we are here for that. I want to offer that up again. You all are great partners to us, and we want to continue to try to be great partners back. So if there's anything you need, please let us know. But yeah, that's what we're looking up doing nationwide.
Wonderful. Thank you for that update, Hannah. That's really helpful. And thank you for pointing to the event too that we have coming on. At a time when people are finding it harder than ever to live in this economy, having food on the table, and of course, healthcare prices going up. I mean, it's not if this thing continues, we're looking at people who may have had premiums of $200 or $300 now looking at their bill of being $800, 900 or more. And that makes it unaffordable. And people are going to be getting those letters, if they haven't received them yet, really soon. And really, to speak to that impact of what it's looking like specifically in the state of Pennsylvania, I have Dr. Laura Beltran to give us that perspective. And so my colleague, Dr. Laura Beltran.
Hi, everyone. Glad to be here and glad to be able to provide some information surrounding the cuts to Medicaid and also the impact we're going to see with Penny. So just a little bit of background. We have that Pennsylvania has actually been on a strong track of progress over the last half decade. We saw the uninsurance rate drop from 13.6% in 2013 to only 7.1% in 2023. However, with the One Big Beautiful Bill, as the sentiments have been echoed, we see that a lot of this progress is going to be erased almost overnight. And then we see that by 2034, roughly 645,000 to 846,000 Pennsylvanians will be projected to lose insurance coverage, with the uninsurance rate doubling and premiums rising for everyone in the marketplace. Specifically, when we talk about those big numbers, the 645,000 to 846,000, we're talking about roughly 375,000 to 576,000 losses just from Medicaid. And then we have that marketplace or penny coverage is going to drop to roughly 270 by 270,000, which is a drop of 54% of what we currently have enrolled, especially since earlier in the year the governor announced massive, actually the highest enrollment we have seen from Penny. And then we know that a lot of the Medicaid losses are going to be stemming from paperwork and reporting challenges. We see that the provision requiring those 80 hours of monthly of volunteering or work requirements, as well as renewal paperwork every 6 months, is going to inevitably, as we have seen in other states that have imposed similar work requirements, cause people to have delays and to ultimately potentially be dropped from coverage. And then we also have another cut from Medicaid, which is the 90-day retroactive coverage period that's going to be reduced to only 30 days. So individuals receiving care are only going to have 30 days to get new Medicaid coverage if needed, instead of that 90-day kind of grace period they received. However, what we're hearing the most that's going to affect the broadest base of people is going to be the penny cuts, where we see that roughly a quick explanation of what's going on is we have the Affordable Care Act in 2010 approved this enhanced premium tax credits, and then they were temporarily expanded through the 2021 American Rescue Plan Act, and then through the Inflation Reduction Act. So before that, families did not have a cap on their income that they would be paying for health insurance. These bills made it so that no family could end up paying more than 8.5% of their household income. That is, as we have seen, kind of the stalemate that's going on in Congress, with Democrats pushing for those cuts to be extended and then Republicans coming up with every single reason under the sun not to, even though it's clearly what's going to be helping people. And we see that if Congress does let these subsidies expire, as we're kind of on trend for, we'll see that families above 400% of poverty will lose all assistance, and all families will see that share of income caps, that 8.5% cap, disappear. And additionally, we're going to see that while still the majority of Pennsylvanians will remain eligible for coverage, the prices are going to skyrocket. So there's a very useful resource put out by Penny recently that shows that the average annual losses in federal premium income tax for individuals are going to range for about 1,197 in Philadelphia County to more than 3,100 in Franklin and Adams. And then we see that the impact is going to be so much worse for rural communities, where we see that the prices are going to be increasing by, for instance, Elk County is going to be $2,700 additional a year, Snyder $2,714, York $2,800. So roughly we see 2,500 to 3,000 lost in support per family per year. And this is also going to be matched with, if these prices are going up by so much, we're going to expect disenrollment to also be kind of hit hardest in the counties where the prices are going to be increasing. Recently, the center just put out a brief, which I'm going to link later in chat, where we go through every congressional district, every House district, and every Senate district, as well as county disaggregations, to see how many the projected losses of penny disenrollment coverage, as well as the projected losses for Medicaid disenrollment coverage. But just kind of to end with a little very quick example, we see that for some households, net premiums would more than double. So if we take a family of 4 in Philadelphia County earning roughly $78,000, they're going to be expected, what they currently are paying most likely is around $260 per month, just 4% of their income based on, again, the income caps that were previously approved. And that $260 per month is going to jump to $541, roughly 108% increase. Similarly, we have that for a married couple in York County, say they're earning roughly $82,000 a year combined income. Maybe they're currently paying $586 per month, with that 8.5% cap on income, to nearly $2,976 per month, which is a 412% in income, which is absolutely insane. And then still the average increases for the majority of families, according to what was reported by Penny, was going to be 82%. So as kind of I mentioned in the beginning, that's why we see that our penny insurance coverage might drop roughly by 54%, from the 520-ish thousand we're currently covered to 270,000 individuals losing coverage because of this insane price increases. And I think that's all I have. Please let me know if you have any questions.
Well, I'm glad you kind of stopped there, Laura. I mean, just piling it all on for all of us. Yeah, I was hearing between 270, 275,000. One of the things we're doing at our vigil is thank you, SEIU Healthcare Pennsylvania. They're bringing 270 or 275 tea lights that we are going to set up. One of those is for every 1,000 Pennsylvanians who could lose their healthcare coverage. And that is going to be there with, we have folks from the faith community who are going to show up at this candlelight vigil that we are doing. And then we're going to juxtaposition that with the fat cat smoking his cigar while they're raising funds, while the Speaker of the House and Congressman Bresnahan are doing a fundraiser in a private club where they actually do smoke cigars. You can't make this up, across the street, instead of actually taking care of everyday Americans and the constituents in that district and making sure that we can actually afford our health care. So Laura went through a lot of numbers about what it looks like in Pennsylvania. Please put your questions in the chat. And to speak to that, what does it actually look like? I am so proud and pleased to have Lynn Widener here. Lynn is an incredible warrior for justice. She has a story to share. She's with SEIU Healthcare. And Lynn, can you come on and share your story about what this is looking like for you and your family and for others in the union as well? Lynn, if you're speaking, you're on mute right now. And we can't see you. There we go. All right. Thank you,
it was
Lynn.
disabled. I kept clicking till it came on.
There you go. Well, thank you, Lynn. It's good to see you again.
Hi, thank you. Hey, everybody. Thank you for having me here today. My name is Lynn Widener, and I am a home care worker. And that is an interesting field, but I've been working as a direct care worker for the majority of my life. So for like the last 20 plus some years, and the last 15 in home care. I live in Allentown, and I am also a member, an executive board member of SEIU Healthcare Pennsylvania. They are the state's largest healthcare union. If you don't know about us, we represent home care workers, nursing home workers, nurses, hospital workers, all across the Commonwealth. So I guess what we're here to talk about today is healthcare. And the reason that I'm here is because these cuts are incredibly important and deeply personal to me. A lot of home care workers, especially people in my position, we don't have access to employer provided insurance. So I rely on Penny for my healthcare. And what's happening right now is really an emergency for caregivers. The Affordable Care Act enhanced credits are vital to me being able to continue to have insurance. If they're not extended in this funding bill, I got a letter in the mail the other day that said my premium will go up by 82%. 82%, and there's about 450,000 of us who are relying on Penny, and that's like some of us are looking at 300% increases in our insurance. Absolutely ridiculous. And what that means in reality is that these increased premiums are going to kick as much as 270,000 people off of healthcare coverage. I'm one of those people. I make $14 an hour currently. That is the maximum rate for my job. I can't make any more than that. I do not have paid time off. I do not have employer insurance. Yeah, I have straight time. That's it. I don't even get overtime because my consumer I live in the same household as my consumer. So I don't even get overtime. I work 79 hours a week. There's absolutely no way, because 79 hours a week is the equivalent of 2 full-time jobs, right? That gets me paycheck to paycheck. I can't even imagine. I literally was talking to somebody who, let's just say, comes from a place of more privilege and said, well, you're just going to have to get a job that provides health insurance then. And I was like, yeah, imagine that. I work 80 hours a week now in home care. My mother has Alzheimer's and I care for her daily without pay. And I'm also a nanny to my 14-month-old niece. So if you hear a baby yelling, that's what's going on. She's running around the background. There's no possible way for me to get another job. There's no possible way for me to work more or take care of more people. At this point, I could use a hand, I could use some help. My insurance right now is $450 a month. $450 a month for my medical includes my tax credit. There's absolutely no way that an 82% is what, $700-800 a month. I can't afford that. There's no way. I need my insurance. People rely on me every day. I need to be healthy in order to take care of other people. Back in January, everybody got some horrible virus cold that was not COVID, but everybody got sick in my house and everybody got to rest and recuperate. But I was taking care of everybody, and I was the one that ended up in the hospital, and they were the ones that ended up with no pay. Now, my insurance covered my hospital stay this year. What's going to happen come January? I have no idea. What about my medications? I can't wean myself off my asthma medication. Like, I don't know what I'm going to do. How am I going to be able to breathe in order to take care of my loved ones and my family? If I can't stay healthy, who's going to care for my home care client? And the reality is that I'm one story. I'm one person. There are thousands of home care workers that are in my exact situation, if not worse. And you look at healthcare as like a triangle, right? Home care, we're the base. Like, we keep people out of the nursing homes. The nursing homes are already understaffed and there's too many people trying to cram people into rooms. Like, they're already overrun. And now you're going to take people who would have been able to get their care at home and you're going to take their care away. They're going to end up in nursing homes. When nursing homes can't take people, they get sicker. They end up in the hospitals. This whole thing our entire healthcare system relies on caregivers like me staying healthy. If we can't care for our communities, if we can't care for ourselves, we can't continue to care for our communities. And remember, all of this is coming on top of Medicaid cuts, because there's a lot of healthcare workers and home care workers who also qualify for Medicaid. I don't right now, but a lot of people do, because our pay is so low. In some parts of the state, where our pay is as low as $12 an hour, and it's not a livable wage. This, on top of Medicaid cuts through the big bloated bill, cutting $1.2 trillion out of healthcare, mostly out of Medicaid. Yeah. Sorry, the baby's yelling at me. This endangers coverage for nearly 600,000 Pennsylvanians exactly like me, and we're expecting that the cuts are going to lead to closures of at least 60 healthcare facilities. These, healthcare facilities are often in rural areas. Cuts to home and community-based community-based care. I looked at the chat and I saw you say story. This is largely because of cuts and loss of coverage of uncompensated care. So you imagine people get kicked off their insurance, and when they get sick, they end up going to the emergency rooms. Emergency rooms are required to take care of people anyway. Hospitals end up not getting reimbursed. When that happens, then they don't get reimbursed. When hospitals can't pay their bills, what do? One thing that they do is either they shut down because they can't afford it, or two, they raise prices. And both of those things are true, and both of those things are going to happen. The rise of healthcare deserts. I don't know if you've heard of this, but they're closing down hospitals already. In a lot of areas, it's already hard for people to find the care that they need. It's just going to continue to get worse. We're all going to see a lot more of that. We're going to lose doctors, local care services, and people are going to have to travel. I know already 3 years ago, I know somebody, let's just say that, who broke their leg and had to drive 3 hours to the closest place that could deal with the severity of the break. That's going to increase because the nearest hospital that was 3 hours from them is now closing. So he has no idea what he's going to do. He's talking about moving closer to a city, but he can't afford the rents. It's ridiculous. These funding cuts are also going to cut out jobs, around 60,000 jobs in the first year. Obviously, that has a huge impact on our economy. They're going to be creating nearly $5 billion in decrease to the state's GDP. And ultimately, when you think about all of this stuff together, these cuts are killing people. These cuts are leading to an increase of around 2,500 preventable deaths in Pennsylvania each year. So you hear a lot of numbers, but take it down to people. Look at me and people like me. We're the ones that are going to be suffering. People that could pass away, could die because of this cuts in our healthcare system. Everything is integrated. It's going to impact every single one of us. Workers, seniors, people with disabilities, families. Even if you're not on Medicaid or Penny, even if you're not facing a loss of services, you are going to be facing higher insurance costs. This affects all of us. I also say, like healthcare workers, when somebody comes in to a facility, when I walk into somebody's home to take care of them, I'm not asking them to see their voter registration card and see if they're a Democrat or a Republican. Do I look at your politics when I try to take care of you? When you walk into hospital, do they ask you? This is a bipartisan issue, guys. Everybody needs health care. We all deserve to be taken care of. I grew up in a very conservative, evangelical Christian household. We believed in strong family values. I would say my family has continued on those strong family values. And it seems that in some ways our political party has moved the other direction. Where are the family values now? Cutting healthcare for working people? That does not seem to be supportive of family values to me.
Mhm.
We're doing this for what? So that we can give more money to people with yachts, with private jets, because they need more, right? Or is it us that needs it? The American middle class being destroyed. My neighbors, we can't afford rent, our groceries are going up, and billionaires are blasting off into outer space on an ego trip. I mean, really, it's disgusting and it makes me sick and it makes me angry. And we need to come together. We need to unite. We need to tell politicians to stand with us and not with the billionaires and not betray us, the working people who put them into the positions that they are. Their job is to work for us. They cannot back down and they need to protect our care. Thank you very much for
Lynn.
giving me time today.
Lynn, I know of your story and how powerful it is, which is why I wanted to give you as much time as possible. Folks, I know just hearing it once again, I go through thinking about, first of all, how sad it is, and then like how frustrating it is, and then it makes me angry. If you have been moved by Lynn's story, I would ask that you use the online tool and contact your member of Congress right now. This is what needs to happen. It's the only way we really move through this. And Lynn, thank you for your service, taking care of others and dedicating your life like this. You are, I don't know how you do it. You're an amazing inspiration. All right. I want to bring us back to Jess Britton. Jess is another incredible warrior who is working like really hard in in numerous congressional districts and lifting up voices of others as a comms director for Action Together NEPA. Jess, could you weigh in a little bit about what we're hearing from folks locally? And by the way, I just got some news. The pressure that we've been putting on with our vigil, with the Speaker of the House coming to next door, apparently the Speaker has canceled. Now, there was a security sweep through the building yesterday, so that just happened. And this is what our work can do. We cannot tolerate millionaires and billionaires raising money at a time when we are in the situation that we are in right now. And all of us are in this together. So, and that vigil will go on. And we will have that fat cat sitting over there with his cigar, Mr. Riggs, while we have people from the faith community and people like Lynn talking about what this means to us every day here in Pennsylvania. So, Jess has been an incredible partner in making that event happen, by the way. So, Jess, I'm going to turn the mic over to you, and someone's at my door. Go ahead.
It's Mike Johnson. He wants to talk to you. He's mad about the vigil. No. So hi, everyone. As Dwayne mentioned, I'm Jess Britton. I am the communications director for Action Together NEPA. We're a grassroots progressive advocacy organization, and we operate, I just realized that the map is behind me. We operate in all those counties there. So we're in the northeast quadrant of PA. And I'm just going to take one step back for a minute. And also want to just thank Lynn, both for the work that you do, which is extremely important, and for sharing your story and being such a powerful advocate. As someone who had two grandmothers who were able to stay in their homes much, much longer than anyone could have anticipated because of amazing home healthcare workers like Lynn, so much respect for that work, and you deserve healthcare that's affordable and so many other things that we don't have time to get into, that you deserve for doing that work. And then to be able to speak out is really powerful. So thank you for sharing, and thanks to all of our other amazing speakers for the work that you do. And thank you to you all for being here. So as Dwayne mentioned, and I like that when Dwayne said, the next feeling that you get is angry after you feel, a little sad and a little like burned down by what's going on. That's always a good point to kick it to me, because what I like to do is take that anger and channel it into something that people have to hear. And working as part of an advocacy organization in Northeast PA this year has meant hearing so many stories, like Lynn's story, like I see Jen on here. I know Jen is sharing her story with us at an event on Monday, and has shared her story multiple times as a healthcare advocate and as a mom. We get these stories, and then we make sure that the congressional representatives and all of our representatives hear them, whether they want to or not. That is the key, right? Whether they want to or not. If they're not going to listen to them directly, we're going to make sure that those stories end up in the press, on social media, and in other places. Stories like one from Nicole, who lives in Pittston, who we spoke to a few weeks ago. Nicole's a local salon owner. She owns her own salon, she's independent, local small business. This is what everybody wants, right? Pull yourself up by your bootstraps, open your own business, stay in your community. Well, Nicole has owned her salon for 16 years. She is closing it this year. She's in the process of telling her clients because she will not be able to afford her health insurance. She has several health conditions. Going off her insurance, first of all, should not be a choice that she has to make, but she can't do that. So she's getting an office job, which she doesn't want. So she's also not going to be as happy, right? She's getting an office job that has full benefits where her health insurance will be covered because she cannot afford the increased premiums. It's hearing from people like Tina in Bloomsburg. So I'm coming to you from Wilkes-Barre today, but usually you see me coming from Bloomsburg. Tina, who is in Bloomsburg, who has 2 young adult children who are very close to needing to get their own health insurance. And what she shared with us is that she's terrified of how they're going to do that. And, you know, as a parent, as a mom with kids who are similar age, I look at that and think it is already hard enough to start out, right? It's hard enough to get started and like enter the world. There's so much pressure on our young people. And then we're gonna just let them have to pay double for their health insurance that they need. That's ridiculous, and we can't stand for that. We have stories from people like Les, who lives in Wilkes-Barre. Les shared that from the time he was 18 till the time that he was 51, when the ACA passed, he did not have health insurance coverage at all. His premium right now, he pays $190 a month. His premium is predicted to go up to over $800. He's an asthmatic. He desperately needs the coverage that he gets. And he's just basically admitting, I'm not going to be able to afford it and I'm going to have to let my insurance drop. These are the stories that are ripping hearts out everywhere as we're sharing them, as people are hearing these stories. But we need them to make people mad. That's just the basic fundamental need, because we need people to then show up in big numbers, speak out, put pressure on our representatives, and say, we will not stand for this. Your job is to take care of your constituents. Your job is not to be beholden to a bunch of billionaires, to be beholden to other elected leaders. You serve your constituents, and this is what's happening to them. So that's why Action Together, in coordination with so many of the other organizations on this call, as part of the Pennsylvanians Together Coalition, it's really vital that we get out and we hit the streets sometimes, and we hold events like a vigil. And then I will also highlight, I think Dwayne dropped it in the chat earlier with a helicopter emoji. A lot of the work that we do is in the 8th Congressional District with Congressman Rob Bresnahan of secret helicopter and Medicaid stock trading fame. And we hold a weekly action to hold him and Senator Dave McCormick accountable in Scranton. We're having a special edition version of that this Monday. And boy, are those helicopter images going to feature very, very prominently, because here again is someone who's making videos for his constituents, telling everybody what a good guy he is, while he's keeping up exactly what he's been doing since he got into office, which is looking out for himself and his political buddies and his billionaire backers, and just lying and deceiving and letting down his constituents left and right. So we're excited to be able to work with, I see our friends from Affordable PA on this call, excited to be able to work with them to really hold Congressman Bresnahan accountable. And we do similar actions in our other congressional districts because it's so important to lift up these voices of the people who are suffering while the rich are getting richer, billionaires are getting tax breaks, and the rest of us get screwed. So thank you to Dwayne and the Penn Policy Center team for letting us share a few of those stories here today, and always looking forward to working with all of you, everyone on the call, to fight for the things that we deserve.
So folks, we've heard a lot of stories today, Lynn's personal story and the ones that Jess just gave us, but you have a story too. You have a story about your family. You have a story about your neighbor, your coworker. You have those stories as well. And I would encourage you to contact your member of Congress and tell them that story right now, why it is more important for you to have affordable health care than it is to give billions of dollars to billionaires. It's that clear. It is that clear. And right now is the moment that we can make a difference when they are trying to decide whether or not we can have affordable health insurance. When that's on them, when that is what the fight is over right now, and why they have shut down the government, because they don't want to have that discussion. They don't want you to be telling them about how important healthcare is and how we shouldn't be sending billions of dollars to billionaires. I challenge you to find one member of Congress on the Republican side that says they shouldn't be sending billions of dollars to billionaires. You won't hear them say it. You will not hear them say it. So we have to say it. We have to say it because that's what it's about. All right, Jeff, I'm going to turn it over to you. I don't know if you've been there. The chat has been wild today, but maybe there's a question or two that you might be able to lift up while we're still here with the last few minutes of the call. Let's see what you got.
All right, scrolling back here. So Art asked a question in the chat, Art from Northwest Pennsylvania. Feds shut down, no budget for PA. What does it mean for counties, county governments, and their budgets? It wasn't to anyone specifically, but maybe one of our speakers.
Maybe
Mark looks like he's going to jump in there.
Laura, yeah. Mark.
At the moment, the state budget shutdown is even more serious than the federal budget shutdown, because a lot of the federal money flows through the state to the counties, and counties have not been getting that money because the state shut down. There is some direct funding. It's not all going to run out immediately, but it can start running out in the next couple of weeks. Programs that, and I am not always sure which programs get directly funded and which go through the state. But for example, I think LIHEAP may be directly funded, and there's only a certain amount of money the federal government has stored up for that, and that could be a problem going soon. We will, if this goes on for another week or so, we will do a report to let you all know what the hit on our state facilities, on the state governments and the counties are. But at this point, I think the state budget problem is more serious because they've gone a long time without that state money. We know a couple of counties in Western PA already laying people off.
Thanks for that, Mark. We have a question here from Jan, and I recognize we're at 2 o'clock, so we don't have a lot of time here. We're kind of wrapping up shortly. But Jan asks, or says, my Medicare Advantage plan was discontinued per letter from Highmark yesterday. Earlier, they had sent me info about how the plan would continue. Now I was told to disregard any previous communications. Has anyone else experienced this? I assume the contract with Medicare has been discontinued. Not sure if there's anybody who has a direct answer for that one, but that was one that we got here. A related Medicare question that we may have an answer for is there a rule that after a certain amount, Medicare will be cut? That's a question from Margaret.
Jeff, there is not in far as that, there is not a rule about if Medicare is funded too much, it gets cut. There's a budgetary rule at the federal level that basically says, if Congress is going to spend X amount of dollars, it's called pay as you go. And what it basically means is if Congress is going to deficit finance, let's say trillions of dollars of tax cuts for billionaires, they have to have a dollar for dollar cut to mandatory programs. Now, Republicans have not waived that rule, basically said, hey, that actually doesn't technically exist for what we must do. So if by December 31st they do not waive the PAYGO rule, there will be about $500 billion of direct cuts to Medicare. However, I will just say that is a little less immediate, even though December feels like right around the corner. And that can be dealt with in another legislative vehicle. Right now, I would say that the shutdown is mainly focused on the expiration of the tax credits, which is more immediate given that November 1st marketplace deadline opening. But just so folks know here, I'm going to type that into the chat. It is called the PAYGO rule. If you Google it and you spend some time reading, you can find out a little bit more on that. That goes into some technical explanations. And again, happy to also share some information with Mark and Dwayne, so they can follow up with folks, somewhere down the line about the specifics around that.
So folks, thank you, John. We are over time right now, but I did put my information in the chat. Thank you for joining us and staying on for a full hour. Obviously, we had the latest information here. As Fody kicked off this call, things are changing by the minute, by the hour, by the minute. We will keep you updated. Mark Steer talked about how we will be putting out information that's relevant to not only the federal, but also the state and what's happening there, and how we can, move through this time that's really challenging for us in our healthcare and our budgets. Feel free to reach out to me also regarding any of the events. And if you want to have an event in your local community, I will help you with all the tools that we have to make sure that that event is a success. So feel free to reach out to me. And with that, we're going to end our call. And I want to thank you all very much. Go ahead and grab what you can from the chat. We'll leave it open for a while here so you can grab all the links, and feel free to reach out. Thank you.